The International Conference on AIDS and STIs in Africa brings together key stakeholders in the field of HIV/AIDS. The goal is to highlight the progress made in the response in the fight against the pandemic on the African continent. The host country, Zimbabwe, is among 5 countries on the continent that is working hard to win the war against AIDS.
There are 5 countries, including Zimbabwe, that have also already achieved those midterm targets of 2025. Botswana, Eswatini, Rwanda, and Tanzania. 16 other countries are close to them, also heading towards achieving the midterm targets, meaning that we could end AIDS as a public health threat in those countries by 2030.
Despite all the continents making some progress in the fight against the pandemic, some key groups like girls, women and children are affected due to lack of access to services and treatment.
About 30% underdiagnosed children eventually die by the age of 2 years. We will see in this day age babies that are not tested for HIV. If you take 100 children born with HIV and parents are unaware, in this year of the life, we lose 30 of them. This is how bad it is. By 2 years of age, if you do not do anything about it, we lose another 30. Because of lack of testing and treatment, a delayed diagnosis is a serious issue in the country. These children will die. If not, they grow up, they will ill, and they will develop meningitis, which affects their development.
Zimbabwean President Emmerson Mnangagwa has committed to unrestricted provision of HIV services for adolescent girls and young women as well as boys.
The 2022 report by the United Nations AIDS clearly reflects that AIDS continues to claim lives and is a call for continued action. Regrettably, new HIV infections continue to be prevalent among our people, and our women accounted for 63% of all new infections, while new HIV infections among adolescent girls and young women remain widespread in sub-Saharan Africa. We should never relax. AIDS is not over. The pandemic remains one of the silent threats to sustainable socio-economic development.